whatever you got going on, man. I hope it was fun. Thursday is come and gone. Friday has also come and gone. Here we are, Saturday. And I just wanted to hop on and remind everybody that open enrollment is coming to an end. If you haven't selected your health insurance plan, if that's what you're shopping for, then you want to make a move and do that quickly. Make it happen sooner rather than later. But if you're one of those people that wants to really change things, get away from the traditional insurance situation, but still provide yourself with the care that you need when things arise, then I would definitely recommend playing with the calculator that I'm going to put and leave in the description below. That calculator allows you to check your plan premium in less than 10 seconds. Just put two pieces of information in your date of birth and how many people you're looking to get covered in the household, and you get your coverage information as far as the benefits that you could receive in a matter of seconds. Now, why is this important? It is important, very important, because right now we're in open enrollment. And on Monday, I'll be helping people shop for plans. And the last day to shop for that plan would be December 15th. So if you haven't shopped and figured out your situation by December 15th, then you're not getting a plan starting January 1st if you're looking for insurance. It's just not going to happen. Now, there's other solutions that I do want you to know are out there so that you can take advantage without overpaying and still getting the care that you need. The reason that this has become a passion of mine, something that I can't stop talking about, is because there's a lot of people that are struggling right now to just live life, and healthcare is one of the big reasons that they can't do that. A lot of people will be finding themselves in the same situation here shortly once they actually start taking advantage of looking and shopping to see what's available. Because my feeling is that most people haven't started shopping. Most people are still getting into holiday mode and getting ready for, Christmas and New Year and things of that nature. However, this is an important thing that's going to keep you in a good place or may put you in a bad place if you don't have it set up correctly. What I never understood is the fact that it's once a year that we have to do this. We do this once a year. And so many people can't seem to find 10 minutes, 15 minutes, 20 minutes to invest in making a good decision once a year. And that lack of patience, that lack of wanting to spend the time and invest the time in getting their health care together costs them thousands throughout the year, maybe even hundreds of thousands. I see this with individuals, families, and with businesses, which is why I created the calculator. And I will leave it in the description. So if you want to play with the calculator and see exactly how much it can cost for you to get you and your family covered, feel free to use it. That's why I created it, so that you can know before you go out and overpay for your health care that, hey, there's a different way to actually get the health care that you're looking for and keep more money in your family's budget. It's that simple. The tool is free to use. Information that you get, you can take and do what you will. But like I said earlier, most people aren't getting that information. What's going on? Beyond the Score, Hannah Hammond. Welcome to the live, man. Hope you guys are doing well wherever you are watching. I'm just talking a little bit about healthcare. Since we are in open enrollment here, a lot of people have not started shopping. A lot of people haven't even thought about what they're going to do for next year because they're just used to auto renewing. What's going to happen is it's not going to be the same plans that you're going to see for 2026 if you were looking at 2025 and expecting that you're just going to auto renew, keep everything the same. There's lots of changes. I wouldn't recommend anybody just renew and keep everything the same without looking at the details and making sure that what they're paying for still makes sense. So, like I said, ladies and gentlemen, I just wanted to do a quick live and let you guys know that time is moving, whether you're focusing on, Christmas, Thanksgiving, New Year, whatever it is, there's still a deadline to apply for your health care. Now, before time runs out, I always say this. I would recommend that you take action now and start doing whatever you need to do to prepare for January. When it comes to healthcare, there's only a certain amount of time that they give you to find a plan that you're going to use for the year. If you miss that deadline, guess what? I can't help you. There's nothing that I can do if you want insurance. You just have to wait till next year when that deadline comes around again. But the fact of the matter is, like I've been saying, there's other solutions out there that you can take advantage of. And matter of fact, I'm going to go leave a link to the calculator. Again, think about if you've ever shopped for insurance, how long did it take you to go through that process? And I know that's why a bunch of people do not want to shop for insurance. They don't want to think of the time that it's going to take to speak to an agent, to go through all the benefits, to figure out if this one or that one, and then they might have to talk to their spouse and do all of this research. And too many people miss out on just taking that time once a year to pick a good plan. So with this solution, you don't need hours to pick a plan. You don't need even an hour. If you understand a deductible, which is the amount that you're responsible for before any insurance company or program is going to start helping you cover some of the costs, then you're good. If you understand your out-of-pocket max is the amount that you will be responsible for in the worst case scenario, and you're okay with the amount, then you're good. And obviously you have to pay for the plan. Sometimes it baffles me because people think that because they're paying or overpaying for the premium, that when they go to the doctor or when they have an issue, they shouldn't have to pay because, hey, I've been overpaying every month. That's not how insurance works. And insurance is working the way it was designed to, which is make profits over protection and care for the people. And that's why you see all the insurance companies out there, billions of profits every year. And every single year we have the claim denials. But if you really understand how insurance is designed to work, then you will understand that it's working exactly as designed. It wasn't designed really for, majority of the people to really get the care that they need. What it was designed for is for profits to be sent up to shareholders. And with that model, no matter what shiny object they put out there and say, hey, we have this new thing or that new thing, I believe that the model is flawed, and they're not looking to fix it because the people who are profiting understand that. So with that, the calculator will be in the description. Feel free to get in touch with me if you want to have a discussion, have a conversation. It's funny, sometimes people think that I don't like insurance, and I work in the field of insurance, so don't get me wrong. I understand insurance, and I don't like the way that it's presented. Let me put it that way. I don't like the way insurance is presented. There's a lot of confusion, and people don't understand half the time what they're paying for, what insurance is supposed to do for them, works, and there's still some things I'm confused about, and I've been licensed and working in the field for years. So again, the design, insurance itself is not designed for you and me to understand it easily and understand how the benefits work and take advantage of it. It is designed for us to overpay. It is designed for profits to get shot up to shareholders, and it's designed for it to be confusing and complex, period. So if you want a different situation, a better situation that provides you with the care, that gives you the care that you need without overpaying, leaves more in your budget every single month for you to do other things other than just pay for healthcare that you may or may not use, because it's just in case that we're paying for, right? A lot of the times insurance we're paying for just in case. Think about it. Health insurance, homeowners insurance, auto insurance, all of these things. We don't know if there's going to be an accident. We don't know if there's going to be a fire. We don't know if there's going to be an earthquake. We don't know what the future holds. So we say, let's put that risk of if that thing happens in somebody else's hands. And that's simply what insurance is. If something happens, is there somebody else or some entity that's going to come in and take care of the damages or the liability that I don't want to be responsible for? That's simply what it is. So if there's a better situation that you've been looking for and haven't been able to find it, you're on the right video, because in the comments, I will leave that calculator. Feel free to play with it. If you have questions, comments, concerns, whatever the case may be, I'd love to assist you. But one of the things I always say is I don't read minds. So you will have to leave a comment and then we can go from there. Let's keep the conversation going in the comment section down there. And if you know somebody who could benefit from using the calculator or learning more about how benefits could help the way they would like, tell them to get in touch, share the video, and we'll talk soon. Guys, stay safe, man. We'll talk in a minute, but stay productive.